very engaging talk. It was a very insightful talk about the platinum-based nanomedicine for cancer therapy. We have a lot of questions coming in. Before proceeding with that, I would like to take this opportunity to thank Dr. Jinsey, my co-moderator, who has been compiling all the questions for us. So without further delay, let me jump into the questions. So in the introduction, you were talking about platinum-based chemotherapy. It has been used for decades. It was very interesting to see how a certain accidental discovery has played such an important role in cancer therapy. So what inspired you to focus, for your group to focus on this platinum-based products and nanomedicine is one of the questions from the audience. Yeah.
Yeah. So as I had shown that we had been working on various chemotherapeutic agents. So we had started with curcumin, doxorubicin, paclitaxel, but we have seen that the platinum-based compounds are very, very high potential because they are, they are very active. They are they are used in many cancers. And they are water soluble, yet they have high toxicity. So whenever there is a toxicity issue, I think the nanomedicine can play a role. So we thought that we can use this nanomedicine platform to overcome some of the challenges of these platinum drugs.
All right. So you were talking about chlorine E6. So we have a question. Would there be any premature leakage of chlorine E6 from the micelles before it reaches the tumor tissues?
Yeah, that's a great question actually, because if you have anything encapsulated, then how long it will stay encapsulated depends on the micelles, like how strong the micelles forming ability of the polymer is, how these this drug and polymer is interacting. So there may be a chance of leakage, but it may not happen very quickly, because we know that F127 that we have used has a very low critical micelle concentration.
Okay. And another question is about the platinum activation. How do you ensure that they get activated mostly at the tumor site rather than in healthy tissues?
Yeah. So basically, the chance of going to healthy tissues will be minimized because we are using the passive targeting approach and also the active targeting approach. But however, we cannot completely eliminate that it will not go to the to the normal cells at all, because we see that our immune system gets activated and they basically carry it to liver, kidney, and all the excretory organs, and so we see the toxicity there. But when we use the PT2, that has a potential, affinity to bind any macromolecules or anything available. But when we are making as a PT4, that is a prodrug. So prodrug takes time to get activated. So non-specific binding will be minimized for sure. And when it comes to how it converts to PT2, that is basically when it goes through the cells, and inside the cells, in the intracellular compartment, then it gets activated, and then the bond basically breaks and converts it to PT2.
All right. Another question is about the selenocysteine of glutathione peroxidase. One of the audience member suggests that they should have a reasonable affinity to the PT. Have you investigated the potential interaction with your compounds?
Glutathione peroxidase.
Yes, selenocysteine of glutathione peroxidase. Yes.
Right. Yeah. So I think it's a great question. No, we actually haven't done it, but yeah, we could have, I think. Yeah.
Yeah. Yeah. You have extensively studied the chemo photodynamic therapy, combination therapy. So in cases like that, which part do you think plays the major role? Is it the chemotherapy or the PDT?
Yeah. Chemotherapy is there, like, right? It is very, highly explored, and we have a lot of anti-cancer drugs, chemotherapeutic drugs in the clinic. However, the PDT is not that explored. The reason being that it has a lot of toxicity. And why the toxicity is so much? Because, the patient needs to be kept in dark condition. It's a lot of because the laser, unless the laser is irradiated, the drug won't be active. So a lot of, problems associated. So I think that we have to actually, and also, as I said, that those moieties, the porphyrin groups, they are highly hydrophobic. So delivering the hydrophobic drugs are very difficult because they aggregate in the bloodstream. So we don't want to have them aggregated. So that's a real challenge. So if we can make the nano formulations, or we can somehow make them dispersed well, then we can actually we may have more and more of these PDT drugs coming into the market.
Yeah, we have a related question. So, is the increased ROS generation mainly from this PDT, or is platinum itself contributes to this oxidative stress?
Yeah, so it could be mainly from the PDT, but whenever there is a cell death happening, so basically ROS gets overexpressed also. Means ROS formation will also be there. So when the two drugs are given, there could be a synergistic response of producing the ROS. So it may not be only, the photodynamic therapy, but if you have the platinum also, only platinum, that is also contributing to the production of ROS, but the main ROS is being produced by the PDT. But I will say that in the process that both of them are actually causing the apoptosis with two different mechanisms. So there will be ROS generation for both the cases. However, there will be robust ROS production using the photodynamic therapy, as the main part of this photodynamic therapy is to produce a reactive oxygen species.
Aparna, do we have time for a couple of more questions?
I hope, Professor Biswas, it's fine if we can take more questions.
Okay,
Sure. Yeah.
Thank you, Dr. Biswas. So we have another question about the photosensitizers. So you mentioned using photosensitizer in a longer wavelength region. Do you think that it will limit the light penetration, especially in the case of larger tumors? Could you please comment on that?
Sure. No. It actually in the other way, actually, because if you go beyond, 800, even if you go to 900,000, the penetration of the laser actually increases, and it becomes more, friendly to the skin. So there will be no toxicity. While we see that UV, rays have the huge toxicity, the more you go to the NIR or IR region, your the laser will be more penetrating to the healthy cells, and it won't have any toxicity. So the research is going towards that, like how we can make the PDT effect by using the molecules which will not be activated only at the 600 or 700 nanometer wavelength. It should go beyond that. So then only we can get that, the very good benefit of non-toxicity by the laser also.
Yeah, in your study, it looks like the CE6 and the platinum prodrug are conjugated close. Is there an optimal distance that we should be targeting while conjugating?
That's a good question. But we haven't tested anything like that. We haven't tried anything other than that. But yeah, that maybe if we have to go, further detail into it. But as we can see that the chlorine E6 is the only one which is having that 3 carboxylic acid groups, and that we can use to combine with 3 other moieties. So that we can't change that. But however, we can make some distance between all this. While we have the MPEG PLA in one side, which is the PLA being a polymer. And MPEG PLA, the total was 5,000 molecular weight. So which is okay in steric wise, but these two, this PT and PT4 and the azide group was bound to chlorine E6 without any linker. So probably that can be explored to see that whether that is giving more flexibility to platinum to bind with DNA more efficiently.
All right. And how do you control the size of the nanoparticle, as the large nanoparticles might not be the best ones for, say, especially in case of cellular uptake?
Exactly. That's very good point, actually, because we have to always make sure that the nanoparticles stay less than 200 nanometers, or maybe in the ballpark to maybe around 2000, around 200 nanometers, because it actually depends on the leakiness in the tumor vasculature. Now, if the leakiness of the tumor vasculature is not big, then the nanoparticles won't accumulate over the time to the tumor. So the leakiness, the smaller the nanoparticles, better their penetration. So we have to make sure that nanoparticles are small. Now, while we make all the modifications, the size of the nanoparticles increase, but we have to also make sure that we can't do too much of the modification so that it goes beyond 200 nanometers. So nanoparticles in the range of 200 nanometers will be enough for tumor accumulation and will not be recognized, much by the reticuloendothelial system or immune system. Because if the nanoparticles are bigger, then they will be engulfed by phagocytosis very quickly and will be taken to the liver or kidney for excretion. So we have to make it in the way like it comes around 200 nanometers.
We have another question. What were the main challenges you faced while modifying these prodrugs or conjugating them with the HSA nanoparticles?
Yeah. So HSA nanoparticles, I would say that dissolution technique is the only way that you can do it. So human serum albumin, it is always water soluble, so you can't use much of the organic solvents now. But when you have to use the organic solvents, it has to be miscible with water. So that is one of the things. I think this is common for all the protein modifications that we do, and we have to use cross-linker also. Now there is also maybe some challenges that the cross-linker toxicity of the cross-linker. So we can have several of the very biocompatible cross-linkers that can also be explored. So these are the few things that we have to take into account.
Yeah. So there's another question about the synthesis of the platinum-based nanomedicine. Is it possible to use green chemistry approaches for this synthesis?
I mean, we have used hydrogen peroxide. So if there is any plant-based material that produces hydrogen peroxide to make that, I mean, unlike as I would say that we are not making platinum nanoparticles from platinum chloride or things like that, because we are actually making the cisplatin or oxaliplatin prodrug. So this is not a platinum nanoparticles where you use the phyto reducing agents to reduce that to make the platinum metal, to deposit and make the platinum nanoparticles. So we are not using that. So here we are using completely the synthesis. So I doubt that there will be green chemistry which can be applied, but yeah, there may be, because I'm not expert in that, but probably there may be something that can be done by replacing those chemicals that are being used for the synthesis.
Thank you, Professor Biswas, for the very engaging question and answer session. Thank you for taking the extra time to take more questions. And in the interest of time, we'll need to close this session. But before